Horner syndrome. The features of Horner syndrome, as you said, this patient, you see this patient, ptosis, meiosis, and what? Anhidrosis, loss of what? Loss of sweating, and enophthalmos, sunken eye. Okay, so why this has happened? Because of the spinothalamic, the sympathetic chain affection. Sympathetic chain, which is for fight or flight, okay, which is for fight or flight. The sympathetic chain, if you are compressing the sympathetic chain, you will get Horner syndrome. But take care. Sympathetic chain comes from the cortex here to the level of the cortex, the first order neuron. This is the first order neuron to the level of the cortex, to the spinal cord. Then from the spinal cord to the level of what's called the superior cervical ganglia here. This is the second order neuron. So this is the first, and this is the second at the level of the superior cervical ganglion. And the third order neuron comes what? The third order neurons comes what? Along what? The carotid. Okay? The carotid artery. So according to the level of the lesion, we will take the symptoms of Horner syndrome. Why? If you have a stroke in the upper part in the first order here and affecting the sympathetic chain, you will get all the manifestations. You will get all the manifestations, which I mean ptosis, meiosis, anhidrosis of the face and the trunk. So the patient or affecting of stroke or syringomelia or something cortical affecting the first order neuron, he will have what? He will have anhidrosis, loss of the sweating in the face and the trunk. Okay? But whenever you have a Pancoast tumor here due to cancer lung, the Pancoast tumor here compressing the second order neuron at the level of the superior cervical ganglia, okay, you will have ptosis, meiosis, anhidrosis, but the anhidrosis will be to the face only, not the trunk, because the face only here comes after the trunk are being supplied here before reaching the second order. So anhidrosis to the face only, this comes Pancoast tumor or any part to the level of second order neuron of the superior cervical ganglia. The third order neuron here, if you have something in the carotid artery, carotid dissection, carotid aneurysm, carotid stroke, if you have something here in the level of the carotid, you will have what? You will have no anhidrosis. You will have no anhidrosis. You will have ptosis, meiosis, but with no anhidrosis, because the sympathetic chain in the first and second order, they get all the innervation of the face and the trunk as well before reaching the third order neuron. So from the level of anhidrosis, I can what? From the level of anhidrosis, I can assess which type of lesion of the sympathetic chain is being affected. Okay?
Doctor, can you please repeat the beginning?
Okay, first order neuron at the level of the cortex, second order neuron at the level of the superior cervical ganglia, third order neuron at the level of the carotid artery and sheath. So you have a stroke here in the cortex. It will affect what? It will affect the sympathetic chain before innervation of what? Before innervation of the face and the trunk. And so you will have here loss of the sweating in what? In the face and the trunk in the first order neuron Horner syndrome. You will lose the sweating in the face and the trunk as well. But at the level of the second order neuron, like the Pancoast tumor, the famous Pancoast tumor, it will affect here the level of the superior cervical ganglia at the second order neuron. Then you will not have loss of the sweating in the trunk. You will have loss of the sweating in the face only. And from here comes the Pancoast tumor and trauma, cervical rip, anything at this level, it will lose the what? It will lose the sweating at the face only, not the trunk. But the posterior ganglionic lesion, which means the lesions at the carotid sheath which means the lesions at the strokes at the carotid sheath. What happened here? The patient here not losing anhydrosis. He will lose only ptosis and the meiosis. So whenever he comes to you with a case of Horner syndrome with ptosis and meiosis only, what do you think the kind of stroke? It will be at the level of the carotid or cavernous sinus only, above the level of the superior cervical ganglia here. Clear? This is a very tricky part regarding Horner syndrome. Very tricky part regarding Horner syndrome. And that's why Horner